Please describe your role in health technology.
Well, I'm a practicing physician, a practicing clinician, and I'm also a healthcare innovator. My role is as a practicing physician and as an educator to spread the news about the potential of healthcare innovation to improve the way we give healthcare and the way we teach health.
What is it that you have done that makes you known to many people out there?
Well, I've developed as a healthcare futurist, but probably being the physician, the surgeon who did the first operation with Google Glass, the first live streaming of a surgery through Google Glass, that gave me a lot of, influence in a way. And I've developed myself as a keynote speaker of sorts globally, and a TEDx speaker as well. So that's kind of the main, the main platforms that I've used to share the message with the global world.
So what are the key trends you're observing in this market or ecosystem?
Well, obviously there are many, but I think that the ecosystem is certainly interested in and also in need of artificial intelligence and deep learning systems helping healthcare, also about virtual reality and augmented reality, helping healthcare and helping medical education. I think those are probably two key components that we're going to see more of. You know, the technology develops exponentially, and I think that we need to catch up in a way, but we have so many tools that if we use them smartly, we can give better healthcare and we can teach better medicine.
Please explain the benefits that we can expect for patients.
Well, I think that as long as we can connect and communicate better, we can do much better care, much better health care. For example, avoiding medical errors that are preventable. If we use technology to help communication, to connect people in a different and better way, we can certainly see a better outcomes on patients. Now, in medical education, if I can stream, for example, the surgery that I'm doing through a smart glass device, Google Glass, Athier Air, or any other device, if I can stream my point of view live to a group of students anywhere in the world, we can then certainly, improve the way they learn. So that's one small point. I've been involved with this company called Medical Realities, based in the UK. Dr. Shafi Ahmed, a colleague of mine, he did the first live streaming of a virtual reality surgery. People all over the world, almost 100,000 people, almost 50,000 of those with Google Cardboard viewers were able to be in the operating room live while he was doing surgery, watching and listening to the operation in 360 degrees. So people was able to wear the device and then immerse themselves in an operation that was happening in real time. Imagine the potential for someone to learn the technique. Imagine the potential for a patient to get rid of their fears before they go to surgery. When they see the operation, they can be in the operating room at a distance. That's very powerful.
What would be the trends you'd expect in that ecosystem which are not taking place?
Well, I think that the ones I mentioned are barely taking place. I think that virtual reality, artificial intelligence, I think improvements in the way we connect devices and we ensure the privacy of the health information, that's very important. And that will certainly explode very soon. I think that things are coming. We cannot stop development. We just need to catch up with it, and especially we need to have the regulatory bodies, the government bodies, and the administrative bodies, the hospital systems, to engage in this conversation so that we can really make the change happen. Being a communicator, being an educator, for me allows me to tell the message so that the people, patients and the public in general, can see these changes that are possible and then demand the changes and accelerate the change.
Let's have your estimation or evaluation of this Health 2.0 conference in Europe.
Well, again, being a communicator, an educator, that's a role. A conference like this is a platform to share the message in an incredible way. Health 2.0, Health 2.0 Europe, that's a platform that reaches out globally. It's not just Europe, people from all over the world, Latin America, North America, Asia, Africa even, and obviously Europe. People is here, people is also following in social media, following through channels like yours, for example, that allow people to be here in a virtual way. Some in synchrony, some in an asynchronic way, but certainly here and listen to the message, and I think that this is a platform that certainly does the job.